The area being assessed here is the ankle, and a safe setup for this is that the patient is lying down on their back, and the practitioner needs to ensure that they are clearly communicating what they are about to do so that the client understands the movement that they are going to perform. They also need to make sure that the bed is at a good height so the practitioner isn't bent over as it can cause pain to the back. The movements of the ankle is dorsiflexion, plantar flexion, inversion and eversion. Active dorsiflexion. This is where the practitioner tells the patient to bring their feet back towards their shin. Passive dorsiflexion. This is where the practitioner ensures that the client is relaxed and then takes the full weight of the foot by placing one hand just at the bottom of the foot and the other hand on the bottom of the leg and bring the foot towards the shin from the plantar flex position. The movement needs to be a gentle movement and not forced. Resisted dorsiflexion. Practitioner places hands just beneath the toes, whilst the patient must try and bring toes back towards their body, whilst the practitioner pushes against in the opposite direction and says a command, for example, "Don't let me move you." Whilst doing dorsiflexion, the tibialis anterior is contracting. Plantar flexion, active. For this, the patient must point their toes towards the floor. Plantar flexion, passive. The practitioner takes the weight of the foot by placing one hand just above the ankle, whilst the other hand is placed on top of the foot. Once in this position, the practitioner needs to move the foot carefully towards the floor, because if not done gently, this can cause damage to the ligaments. Resisted plantar flexion. So this is where the practitioner tells the patient to not let the foot be moved and push against the hand which is placed just behind the top of the foot. Active inversion. This is when you instruct the client to move their toes inwards towards each other. Passive inversion. The practitioner needs to relax the patient and take the full weight of the foot and now slowly move the foot towards the midline of the body. This can be done by placing one hand at the leg whilst the other hand is at the heel of the foot. Resisted inversion. The client's foot needs to be placed into inversion position so the foot's looking outwards, and the practitioner places their forearm against the foot and says to the client, "Don't let me move you," so they are trying to move their foot towards their body. Eversion, active. This is when you instruct the client to move their toes away from the body. Passive eversion. Once again, take the weight of the foot and ensure that the client is relaxed, and now move the foot from an inward position and take the foot to an outward position. Resisted eversion. The client push against the practitioner's hand which is trying to push the foot inwards, and the client needs to push against this movement and move the foot outwards. This can be done by saying, "Don't let me move you" again. The functional test for the ankle is a calf raise, and the muscles that are being examined here are the peroneus longus and peroneus brevis, which are muscles that allow for eversion at the ankle, the tibialis anterior, which causes inversion of the ankle, gastrocnemius and soleus, which causes plantar flexion of the ankle, and also the extensor hallucis longus produces dorsiflexion. And it is always important that we test both legs and not just one, so we can compare the results.